All right, I'm really excited to share this training with you today. We now know that Epstein-Barr virus is behind some of the most common autoimmune disorders. It's science, it's not a belief, it's not speculative, it's undeniable. There's a lot of studies that I'm going to present today. I'm going to share some of my favorite studies, at least one. We'll talk about citrullination. That can be an issue in an additional hypothesis on EBV and autoimmunity. And then I'm going to share quite a number of autoimmune conditions that have been linked in research to EBV. And sorry about that. And uh, and then I'm going to share some of my clinical pearls since I've been working with this community for several years now. So, my name is Kasia Kainz. I'm Doctor of Clinical Nutrition and CEO and founder of EBV Global Institute. It is my pleasure to share what I know about the autoimmunity and EBV with you today. The connection between EBV and autoimmunity, unfortunately, is missed in many doctors in clinical practice. Um, in their patients with autoimmunity. And this may be the reason why it's such uphill battle for physicians to improve the health of that population. My favorite study is Dr. Harley. It was 2018. He and his team actually looked at this is a profound study. So I'm going to simplify it here, but I will also write a blog on our website, ebvhelp.com, with details of this study and some other issues I'll be simplifying here. But if you like to nerd about science and go for details, it's going to be in that blog for you. So anyway, to simplify it, if you have an infected cell, it's running the infected cell. It's going to use a particular protein, eBNA, to get into the nucleus and to get into the DNA inside the nucleus, your DNA, cellular DNA, that codes for autoimmunity. Basically, you can turn on immune conditions, and there are seven, black and white, that he tracked down. And it was a huge, huge shock to me. Some of them I'm familiar with, but some of them I was surprised about. And the number one surprise for me was celiac disease. Yes, it's on the list, so it's celiac. Type 1 diabetes, rheumatoid arthritis. Like rheumatoid arthritis is pretty classic for EBV. Juvenile idiopathic arthritis. I can tell you stories of some of my patients in the past relaying stories of their childhood and traumatic medical interventions that were painful and unsuccessful for this particular condition, and nobody ever connecting it for them. Uh, Tragic, really tragic. Juvenile idiopathic arthritis. Make sure that you connect that if you have a child with that. Systemic lupus, classic, also a classic presentation of EBV. Multiple sclerosis. I have to say, of all the autoimmune disorders, MS is the best study in terms of EBV, to the point where some researchers claim it is EBV is a prerequisite to MS. Prerequisite doesn't mean that's the only thing, but it is the initial trigger that needs to happen apparently to start the process, and then other things are in place. And actually, the reason I'm standing here in front of you is an inspiration of a beautiful friend I had that died of complications of MS at the point in my life when I didn't know what was hurting her and I was not able to help her. And so I think she's guiding the light and made sure that I found EBV, and I think it was probably her journey as well. So she's on my team up there, helping advocate for all of you and all of your patients with EBV. So MS is huge. And then IBD. So IBD is inflammatory bowel disease, Crohn's, and ulcerative colitis. And I have to say, when I was finishing my book, the EBV solution, this was the last condition that I checked in PubMed. And I don't know why I had this voice in me. Well, check into that, just out of curiosity. And I have to say, I had not expected that anything would come up because I had no idea there was any connection. But studies actually were pretty consistent that about 60% of both Crohn's and ulcerative colitis could be tracked to the initial trigger, again being EBV, and he kind of confirms that as well. That again, celiac, type 1 diabetes, rheumatoid arthritis, juvenile idiopathic arthritis, lupus, MS, and IBD. Huge, huge. Um, the next topic I want to discuss is the citrullination issue. So citrullination is a concept that especially rheumatologists, physicians that work with rheumatoid arthritis are familiar with. In fact, many of them will test for citrullination because citrullination is a process of changing a structure of one particular amino acid from arginine to citrulline. And that particular process can initiate autoimmunity, in particular for rheumatoid arthritis. So again, a little bit more details will be how it happens will be in the article. This is the only virus that does that. Moving on, there's one hypothesis. It's interesting. It's pretty old. I haven't seen anything newer. Dr. Michael Pender in 2012 proposed that deficiency of a particular immune cells, it's called CD8 plus T cell, may cause autoimmunity because then you lack the ability to control EBV. Well, his hypothesis has a couple of points. These cells are supposed to detect and destroy EBV infected cells. Well, the problem with this is it's really hard to detect these cells. The problem with this suggestion is that when EBV infects your cells, it turns off all its mechanisms. So the cell actually cannot send an SOS signal. It's like, I need help, come get me. That is all turned off. He's saying that in autoimmune prone individuals, these T cells may be deficient or malfunctioning, allowing EBV to persist. Possibly. I would also say that there are many other immune cells that are supposed to help you with EBV. So it's an interesting hypothesis. He also says that EBV might even inhibit the apoptosis inside the infected immune cells, allowing them to become autoreactive. Okay, so not sure what autoreactive means. However, it's not might. It actually happens. And infected cells um, have a turned off mechanism of apoptosis. What does that mean? Our amazing cells have a self-destruction mechanisms if in place. If the cell is infected, it will self-terminate to prevent infecting other cells. Can you imagine? That's just brilliant. Such a sacrifice, right? That is all turned off in EBV. So it's not a question of if it happens, it does happen. So the cell, number one, is undetectable because there's no signaling. All that is turned off. So there's not normal conversation between immune cells and the cell. There's nothing there. And number two, apoptosis is turned off, which makes the infected cells perpetual, non-dying, kind of like cancer cells or oncogenic cells are. They live forever, they don't die. Um, so I'm not sure that I agree. I don't think he understands how badly affected the cells already are. The apoptosis is turned off. And then he also adds vitamin D deficiency, if that's in place as well, which is very common. Even if you live in Florida, it doesn't seem to matter, Hawaii, Florida. That creates a perfect storm. And I agree with that. Vitamin D is really implicated in autoimmunity. And vitamin D, by the way, if we go back to MS, vitamin D is one of those factors that really can manifest vitamin D deficiency, manifest in MS. His hypothesis, he's linking to a couple of particular autoimmune conditions, including MS, rheumatoid arthritis again, ulcerative colitis again, psoriasis, and even pernicious anemia. Pernicious anemia is very interesting, I have to say. Before EBV, I specialized in upper gut infections, autoimmunity, all kind of medical mysteries. And I've had quite a number of patients really chronically, dangerously ill, where they were failing, they were losing weight, they were not able to consume normal foods. Dangerous situation to be in, underweight. And that's something that is commonly missed in medical practice. And I have to say that working with the EBV community, I see this condition a little bit more often. So there's definitely a connection between EBV and pernicious anemia. And I've seen some studies linking them as well. All right. So let's look at the list of remaining autoimmune conditions that I haven't mentioned yet. I'm going to look at my cheat sheet here so I don't forget, and I'm going to just read them randomly in not a particular order. Um, Actually, the first one I picked for a reason because it's very common: Hashimoto's thyroiditis or Graves' disease. Okay, so this is a big one, and I need you to hear me on this. We have an epidemic of thyroid dysfunction, most commonly women, and most commonly diagnosed as hypothyroid, so lower function of thyroid. And if you look at studies, more than 90-95% of these cases are actually autoimmune. It's not low thyroid, it's autoimmunity, it's Hashimoto's thyroiditis, eventually causing the decreased function. Very different illnesses, very different therapeutic solutions. And because that's missed and it's not tested properly for it, doctors miss it. And so there are thousands and thousands, if not millions, of women that are miserable under the medical care, medicated, and they're not feeling better. And this may be the reason. So, why am I talking about it? Because in our EBV community, we talk about thyroid pretty much every day. And there's a lot of people with EBV that have Hashimoto's thyroiditis, and some of them are misdiagnosed. So, what I want you to know is I have published an article review where I mapped all of that, the problems, the blind spots clinically, the solutions, what to do, how to test, all that about Hashimoto's in connection to EBV a little bit. Um, and so that's in a medical journal. So we're going to put a link under this video for you guys. So if you know any women, or if you are one of them, or if you are a physician and you're a little confused about that, that will be available for you. So I put it on the list as number one for you today because thyroiditis, Hashimoto's thyroiditis, I feel from my perspective, my clinical experience, what I've seen, so it can be biased, of course, the number one cause of this autoimmunity will be EBV. Other things may be in place, obviously. The number two that I see is H. pylori. And it's not uncommon for me to have somebody in our community that has chronic EBV, Hashimoto's, and also H. pylori. Yep. And so, and that's a big chunk of female population. So this really is something that you wanna hone in on. Now, Graves' disease is a flip where your thyroid goes hyper. So it's like opposite to Hashimoto's. It's also autoimmune. It's also linked to EBV and also other agents, but EBV predominantly, I would think. And one person can have Hashimoto's and Graves, just not at the same time. So that's something that many people may not realize, just for your information. The next one on the list is chronic fatigue syndrome. So chronic fatigue syndrome, there is something in medical literature called chronic mononucleosis syndrome, and I don't think most doctors even know that such a thing exists. So if you have mononucleosis, if you have acute infection, it's supposed to wean itself off in about 6-8 miserable weeks. And then you should be up and going and living your life and having the same baseline as before. But the individuals that develop chronic EBV may just continue with that malaise and it trickles into something that really resembles chronic fatigue syndrome. So the question is, is it chronic EBV or is it chronic fatigue syndrome? And what is the distinction? So there are some studies and they're comparing the two, and it's very, very close. One of those studies is quoted in my book as well. If you want to look, there's a chart and actually comparison. So I would say pretty much 99.9% of people that reach out to me trying to get help with their chronic EBV will say that they've been diagnosed with chronic fatigue syndrome, or they feel like they have chronic fatigue or chronic fatigue syndrome. So the very insidious and laden heavy fatigue is number one complaint in this community. So that's worth noting. Another one is Sjogren's syndrome, when your salivary glands, your glands start to dry out. Uh, Studies have found it's literally salivary glands in your mouth. If you don't know that, the typical entry for EBV is tonsils, so it's right there in your mouth. That's probably why this can happen. Another one is autoimmune hepatitis. Another one is mixed connective tissue disorder. Excuse me. Mixed connective tissue disorder. From my experience, clinical experience, the patients that I used to work with, it was often a combination of chronic EBV and some kind of gastrointestinal infections, infected agents, bacteria, for example. So there were many layers to strip, including EBV. Chronic inflammatory demyelinating polyneuropathy, scleroderma, atherosclerosis even, kidney autoimmunity, if I can pronounce it, glomerulonephritis, that's what it is. Uh, Psoriasis, certain types of it, Guillain-Barré syndrome, idiopathic thrombocytopenic purpura, if I pronounce it correctly, polymyositis, dermatomyositis, polyneuropathy, neuropathy, tingling, numbing in extremities as well. There's many more conditions, and the interesting thing is if you have kind of a rare, surprising autoimmune condition, you don't know why you have it, I would encourage everyone to actually go to PubMed, type in the name of the condition and EBV and see if there's any studies. I keep being surprised. Let's say somebody has interstitial cystitis and they're not sure why. And then I go to PubMed and I start pulling studies and there are connections like, what? Interstitial cystitis? How is that even possible? So there's actually a lot of studies on all kinds of conditions, including many autoimmune, that can go right back to this virus. It's a pretty horrendous virus, as you can see. All right, so let me tell you a little bit of uh, my take on what's happening in the functional medicine, integrative medicine, and when I hope we can move. When a physician works with autoimmunity with a patient, oftentimes there's damage control and there's green pharmacy, let's put you on a protocol, let's put you on supplements, and let's put you on a detox protocol. Let's put you on, I don't know, elimination diet. And oftentimes with autoimmunity, the diet recommended, like a stellar, diet is autoimmune paleo. And I will speak here as a clinical nutritionist and doctor of clinical nutrition with 20 years experience with food and therapeutic diets, is if you have chronic EBV and nothing else, and this is how you present with autoimmunity, then these therapeutic diets are too restrictive and not sustainable. They should not be used long term. And for the purpose of EBV, that's not a good fit. You don't have to restrict. Oftentimes, I have to get people better by doing groundwork for EBV specifically. And as they improve, the tolerance to food improves, and we can then expand the diet just to focus on things that are important for EBV, which is antioxidants and fiber, whole foods, very simple concept. So it's important to really look at the causes. Um, Now the what's next in your case? So let's say maybe watching this, you say, well, I do have an autoimmune. It's not on this list, or maybe it is on the list. So what do I do next? Have you been tested for EBV? I would definitely get a test done. Now you have to be careful with testing because from my clinical experience, what I hear and see is that some doctors may be resistant to testing. Some physicians will test only 3 markers. You need 4 antibodies for it. The panels for EBV often include only 3 markers and not 4, so the fourth needs to be added. And sometimes the physician will add it and the lab will still not run it. So it's a really problematic situation for a patient that is not educated and doesn't know, and for the doctor that actually has not studied EBV. And so I need you to be aware that there are consumer direct labs and you may bypass a doctor and just pay out of pocket, walk in, get your blood drawn, and get your result electronically within 48 hours and have black and white and pick the right antibodies so you know that you're getting the right report. And so this is all available. I need you to know. So also, let me see what else. Another issue is you don't have to be a physician to be able to interpret your lab results. And let me make a very important point here. And this is for physicians as well. Please hear me on it. With results for this particular virus, you cannot go by the medical training. IgG is not only past infection, and IgM is not the one you're looking for as current infection. If you go by this old rule that doesn't exactly apply to EBV, you run a risk of misdiagnosing a lot of your patients and missing EBV in a lot of your patients. And it happens more often than I can tell, which is a source of frustration for me. So, as a result, I have an entire chapter on this lab interpretation, different presentations, how to read them, how to understand them in my book. We also created an entire process, different scenarios, and a 50-minute video training with me, with markers, color markers, with a whiteboard, explaining this. Free, available on our website. We're going to put links under the video with all these resources for you. So you can look at your labs and watch me a few times if you need, or look at the website page and read, or open the chapter in my book and read a couple of times. You can learn that. We also will be launching a live workshop called Bring Your Labs, Bring Your EBV Labs, when I will look at the labs and we will discuss them. I will discuss them and give you my feedback. So it's educate yourself, educate yourself, educate yourself, educate yourself, and be empowered by this training, because you have a lot of control to do things right for yourself. If you are not able to have a conversation with your physician, if you cannot find a physician willing to test, and if you want to know exactly what your labs mean. And what's the next step? The next step for anyone who is struggling with autoimmune condition, any of those that I mentioned today, and if you've already tested and you already know, you have confirmation that's what it is the groundwork for EBV. We have a huge database in my book, so you can't wander anywhere else. You can just get all the evidence-based support on our website, ebvhelp.com. And the next step really is one more step beyond that. And that's beyond today's talk, but it's the question, why do I have chronic EBV? What triggered that? I'll leave you with that because that's a conversation we often have in our community. That's a big question. There's always a reason why you have that EBV. You need to address that in order to change your life. I hope this was a helpful presentation for you guys, and it will help guide you in your life decisions and health decisions. And thank you so much for attending. Give us thumbs up, and I'll see you on the next call.